At this point, even die-hard news consumers have to admit this sad truth about the healthcare debate. It's usually really, really boring. I ask you, is there any writer in the English language gifted enough to compose an interesting sentence involving the long-term financial health of Medicare? No, there is not. But a month ago, a House subcommittee held a hearing where a handful of congresspeople could tear into witnesses with the zeal of starving men eating their first real meal in months. They found a corner of the healthcare crisis that anybody could understand, that would make anybody mad, that anybody would want to get in there and fix. It didn't get much coverage this hearing. It was the Subcommittee on Oversight and Investigations of the House Committee on Energy and Commerce, and here is its chairman, Bart Stupak of Michigan, reviewing the fine print of an insurance application with Don Ham, who's the head of the insurance company that issued it, Assurant Health. What the congressman is trying to figure out in this first clip I'm going to play you is, are these insurance application forms intentionally difficult so an average person would make mistakes filling them out? Mistakes that would later let the insurance company deny them benefits or cancel their policy.
As you said, your Assurant Health questionnaires are simple, easy to understand, straightforward language, so people can easily and accurately report their medical history. So, let me ask you this. In your policy, Mr. Ham, it states in question number 14, within the last 10 years, has any proposed insured had any diagnosis, received treatment for, or consulted with a physician concerning phlebitis, TIA, cystitis, lymphadenopathy, or glandular disorder? So tell me, what is TIA?
I am not aware. I believe.
How would if you don't know what it is, how would anyone filling out your application know what it is? So there's grounds to deny them right there. You don't even know what it is, either do I. How about phlebitis or lymphadenopathy? How about lymphadenopathy? What's that?
I don't know the answer to those questions.
Do you sincerely believe that an average applicant would know what these words mean if you don't know and I don't know?
Sir, I believe that is an application that is not currently used at this time. I would like to
so last year's application. Last year's application. Have you changed the application last year?
I'm not aware if we have changed that application.
His hearing was the culmination of a year-long investigation by the subcommittee into the fine print of our nation's insurance policies, and specifically into something called rescission for people who have their own individual insurance. This doesn't apply to people who get insurance through their jobs or group insurance policies. For people who have individual insurance, rescission is what happens when an insurance company decides that you lied when you applied for a policy with them. You pretended that you were healthier than you really were, or you concealed a serious and expensive illness, or you simply made a mistake without intending to and omitted something about your health that they might want to know. And so they cancel your policy. They rescind it. The problem, according to the subcommittee's investigation, is that so many people get kicked off who weren't trying to deceive the insurance companies at all. They found that if you get an illness, especially an expensive illness, the insurance companies go looking for a way to kick you off. The subcommittee found a guy in Virginia who lost his coverage because the insurance agent who sold him the policy incorrectly wrote down the guy's weight on a form and then never showed it to the guy to double check. A patient in Utah who needed surgery lost their insurance because of a mistake, an omission on their spouse's application. I got a chance to talk with one of the lawmakers on the subcommittee, Congresswoman Jan Schakowsky, a Democrat from Illinois, and she told me that even somebody like her, who's worked on healthcare issues for decades, was surprised to find out that this could happen.
I hadn't even heard of it before, that you could actually be paying premiums, and then exactly when you really need the health insurance, they go back and deny it.
And listening to this hearing, it seems like this was one of those cases where all of you really seem really, truly angry.
Really, truly angry, yes. In a very emotional and personal way. Yeah, this wasn't just another issue.
And explain why.
The very idea that a woman who has been diagnosed with aggressive breast cancer, who was insured, was suddenly told, we're not going to pay for this.
My name is Robin Baton. I'm 59 years old. I was a registered nurse for 30 years. In June 2008, I was diagnosed with invasive HER2 genetic breast cancer a very aggressive form of this cancer. I needed a double mastectomy immediately. The Friday before I was to have my double mastectomy, Blue Cross and Blue Shield called me by telephone and told me that my chart was red flagged. And what does that mean? They said that due to the dermatologist's report,
there was something on her chart earlier about a dermatitis that they took to mean precancerous. And even though the dermatologist called and said, please, this is acne, do not deny her breast cancer treatment, they said no. They said no.
He said, please don't hold up her cancer surgery for this. He begged them. He was the nicest man. Anyway, they said that I would not be able to have my surgery on Monday, and they launched a medical investigation into my medical history. I was frantic. I didn't know how to pay for my surgery. The hospital wanted a $30,000 deposit. Can you imagine having to walk around with cancer growing in your body with no insurance?
And it took her months to finally get the surgery that she needed, by which time the tumor had doubled. And at the hearing, we had to we took a break for 5 minutes while she, composed herself. I mean, she was clearly ill.
Yeah.
And that was so dramatic and moving to every member on the committee.
I go to a cancer support group every week. 4 girls in my cancer support group have had their insurance canceled. It is very difficult for me to speak out. My insurance could be canceled again. I live in fear every day of my insurance company.